Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Please see important safety information at the end of this video and full prescribing information at www.gvokeglucagon.com.
Severe lows are very scary. Tristan's had two very, very scary situations. It's the disease in general. I think you can't control it. You have to manage it. Even with these lows, you have to have the steps and be ready. You have to be organized, but be willing to see that there's a possibility that things are not always going to happen how you planned. Tristan had his first low when he was about 10 years old. I was up in the middle of the night and I saw he was low, and I treated his low with a juice, and then I always stay up after, to make sure the blood sugars are moving up, and I was sitting in the other room with the lights on and I could hear this gagging. I think as a nurse, I feel like I'm a pretty calm, level-headed person, but when it comes to your child, you just aren't ready. It's your kid, it's your child, it's your life. It's hard to see your kid not being able to verbalize with you, not talk to you, and you are the only person that's there to save him. I could hardly even dial 911. Trying to figure out how to administer medicine, how to mix the two products and shaking it and then, remixing it back into this pen. I couldn't even process how to do that. You have just a sense of urgency and nothing else. It's the worst feeling. It's something that I wouldn't want anyone to experience. I first heard about Gvoke HypoPen when I was sharing Tristan's experience of a low with a friend of mine whose husband has type 1 as well. When we had our next appointment with his endocrinologist, I asked if that was something we would be able to look into. It was a really simple process to discuss Gvoke HypoPen with the endocrinologist and get a prescription. Tristan's endocrinologist educated us on when to administer Gvoke HypoPen when there isn't an option to bring his blood sugar up another way. Tristan's second severe low blood sugar happened again in the middle of the night. I was hollering his name and he wouldn't wake up, and he was twitching. It's the beginning of probably a seizure. I knew right away I couldn't give him a juice or anything that was gonna bring him up. I immediately grabbed Gvoke HypoPen and began to administer in the two-step process. Maybe within 15 minutes he was awake, his blood sugars were in safe range again. He's back to like, what's going on? And as we're all like staring at him. But it was a moment of laughter and joy once he came to, because I was just like, oh my gosh, I've done, we've done it, this worked. And the EMTs came, they looked him over, but we didn't have to go to the emergency room. Over time, I told Tristan, this is why I worry so much about you, but I do fear this. And there isn't a night that I don't, hope that this doesn't happen again. You have to be prepared for lows. You don't know when they're gonna happen. My advice to parents that are just starting with Gvoke HypoPen is to be educated about the drug, the side effects, how to administer the medication. Always have it with you. Carry it with you, educate people around you. All of us have the fear as a caregiver, as a parent, the fear of letting go, but we have to let go at some point and let them spread their wings.
Indication: Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Important safety information: do not use Gvoke if you have a tumor in the gland on top of your kidneys called a pheochromocytoma because of the risk of a substantial increase in blood pressure, have a tumor in your pancreas called an insulinoma because of the risk of low blood sugar, are allergic to glucagon or any inactive ingredient in Gvoke, Stop using Gvoke and seek immediate medical attention if you experience any symptoms of a serious allergic reaction, such as rash, difficulty breathing, or low blood pressure. Before using Gvoke, tell your doctor about all the medicines you take and your medical conditions, including if you have not had food or water for a long time, prolonged fasting or starvation, have low blood sugar that does not go away, chronic hypoglycemia, or have a history of a skin rash called necrolytic migratory erythema, commonly associated with glucagon-producing tumors. The most common side effects reported in adults are nausea, vomiting, swelling at the injection site, and headache. The most common side effects reported in children are nausea, low blood sugar, vomiting, headache, abdominal pain, high blood sugar, pain or redness at injection site, and hives. Inform caregivers on the instructions for use of Gvoke and symptoms of severe hypoglycemia, which include unconsciousness and seizures or convulsions. Store in original container until time of use and at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please talk to your doctor and see full prescribing information and patient information guide for Gvoke at www.gvokeglucagon.com.